Hi, my name is Dr. Wellens, and I'm going to talk to you about an interesting case of the week. Specifically, I want to discuss extra bones. Yes, we can have extra bone in our foot, and approximately 10% of the population is reported to have several extra bones, and in medicine we have special names for them. But I think this one is the most exciting one. It's commonly misdiagnosed, but well, let's talk about my interesting case. So I had a 43-year-old female come to my office wearing a boot. I actually operated on her mother, and I noticed that postoperatively she would bring her mom to my office, and she would be wearing a surgical boot that I usually use after, reconstructive surgeries or even bunion surgeries. So one of the days she decided to schedule an appointment with me, and she reported that she had been in this boot on and off for the past 4 years. And I could tell just because the boot was completely worn out. It was definitely on its last breath. And she reported that she went to see several physicians in the area who told her that she had a broken foot and there was really nothing that could be done, and basically she had to live with the pain. Usually when situations like this occur, I tell patients, you should have been here many years ago, because if somebody tells you that nothing can be done and you're 43 and you are not able to walk and you have to be in a boot for 4 years, it's time for a second opinion. So interestingly enough, when I did an x-ray on her right away in the office, I noticed that she had an accessory navicular bone. And of course, it's a very medical term that I'm throwing in there, so I'm going to explain to you what it is. It's an extra bone on the medial aspect of the arch. So this is the right foot, so you can see how it's on the medial aspect of the right foot. And basically it is something that is very important to us, because if you have an extra bone, the very important ligament and tendon called posterior tibial tendon is inserting in the wrong spot. So instead of inserting into the regular navicular bone, and it inserts into that extra bone called accessory navicular bone. So usually people have flat feet, they have a lot of pain in the arch. Most of the time it's diagnosed in early childhood when children are complaining of pain in the arches. But interestingly enough, she was already in adulthood. And if you look at her CAT scan right here, you can definitely see that there's an extra bone right there on the CAT scan. And I actually just saw her MRI, and it confirmed that she has an extra bone that is basically preventing her from normal functioning. And it's interesting enough that she started having a lot of symptoms when she was already in her 30s, instead of it being diagnosed when she was in her teens. So next week I'm planning to schedule her surgery and excise that extra bone and reattach the posterior tibial tendon into the correct navicula where it inserts. And I can tell you is she only would have to wear a boot for about 3 to 4 weeks after the surgery. And I'm so excited that I can get her back to normal activity, because it really breaks my heart to see somebody in a walking boot for 4 years and thinking that absolutely nothing could be done for her condition. And there is such an easy fix. I mean, I know it's a surgery. I know nobody wants to have surgery, and everybody wants to try a non-surgical approach, but sometimes you just have to bite the bullet and do it, because it's worth it. It's worth being pain-free, and it's worth to walk without having to be in a 3D ambulator for the rest of your life. So if you have any questions, or if you want to get a second opinion, please call my office.